Emily Greenfield is a professor of social work at Rutgers, the State University of New Jersey. Dr. Greenfield is an internationally recognized scholar on community-based social innovations for aging in the US. Her pioneering research, teaching, and service seek to bolster community-based efforts towards more equitable opportunities for long and healthy lives. Her work has helped advance understanding of innovative approaches to aging in community in the 21st century. Examples include age-friendly and also dementia-friendly community initiatives and supportive service programs for naturally occurring retirement communities and village organizations. She's received support from the National Institute on Aging and conducts research on how social inequalities stem from childhood, especially in the context of structural racism and how these influence later life cognition and well-being. So please join me in welcoming Dr. Emily Greenfield.
Thank you so much, and welcome everybody. It's really a privilege and a pleasure to be here with you all today. I'll go ahead and just share a little bit more background about myself and my social spatial positions. So yes, I am in New Jersey, not far from New York City. And I just want to acknowledge that Rutgers as a university stands on the land that is the ancestral territory of the Lenape people, and acknowledge that our university, like New Jersey and the United States as a nation, was founded upon the exclusions and erasures of Indigenous peoples. My own academic background, I have a PhD in human development and family studies with a focus on life course social relationships and health. And I've been on faculty at the School of Social Work at Rutgers since 2007. And recently I was appointed as the lead on a newly created hub for aging collaboration within the School of Social Work, which I'll discuss later in my talk. It's really wonderful to be able to talk about topics that are so much on my heart and mind, and hopefully share in a community through the Gilbrea Centre that's similarly interested in these themes. I want to briefly just give you a highlight of what my objectives here are with our time together today. First of all, I want to help you all be able to even better explain how community-centered approaches to aging differ from what I would consider more traditional approaches. To be able to list examples of community-centered approaches alongside key challenges for their development and implementation. And then finally, to be able to describe the importance of collaborative research for strengthening community-centered approaches in aging. But before we launch into this, I just want to begin by congratulating you all for being here, to all of us for being here today with our interest in the study of aging and its many, many facets and diversities. It's such an exciting historical moment to be part of this enterprise. I feel like, especially since COVID has even just accelerated a global understanding of the importance of thinking about long lives and social context. And we've come so far to move beyond kind of traditional messaging around care and deficits and frailty, not to say those things aren't important, but balance those narratives with other ways of thinking about approaches to aging. And I want to just share this slide that comes from the Frameworks Institute and the Reframing Aging Initiative, which is a major campaign among national organizations on aging in the United States to use evidence-based messaging on aging in ways that turn them into the field, as opposed to turning them off in the context of systemic ageism. And this is a quote from one of the Frameworks toolkit on how to combat ageism and offer alternative ways of thinking about it. It's the concept of ingenuity. It says, as more Americans live long and healthier lives, we need to tap into our national ingenuity so we can adjust our systems and policies to make the most of this new reality. I just want to pause here for a moment and think critically about this part in particular. Adjust our systems and policies. So when we think about what are the opportunities in our own lifetimes for improving, for introducing innovation and ingenuity into systems and policies for aging, what typically comes to mind? So I pose this question to the group. What systems and policies related to aging do you think receive the most attention in the US or Canada? I can definitely speak from the US perspective. I'm interested in hearing what you think from the Canadian perspective. So I'll ask the people who are joining us remotely if you want to just put your ideas into the chat. And for the people who are here with us live, if you want to turn to the person next to you and just share a thought or write it down in your own notes. And I'll just, for the people who are watching the recording, I'll narrate what we see in the chat here. So go ahead, and what systems and policies come to mind as priority in my common discourse on aging in your national context? Great, thank you. Janet says healthcare. Pensions, thank you, Nicole. Yes. Feel free to ditto. Housing, not enough. Healthcare, long-term care, thank you. Yeah, okay, well, I think it's fair to say, yes, similar ideas as to mine. First, yes, healthcare is a big topic on aging in the US. We see it's October is open enrollment season for people to change their Medicare plans. And so this is from a CNB, a major media outlet in the United States that's informing people on what does open enrollment mean and how they can go about changing their prescription drug plans. So yes, definitely healthcare, and relatedly long-term care as getting increasing attention, rightfully so. And here's a recent Washington Post article about the shortage of direct care home health aides in our current economy. And yes, also economic security. So this is a recent article from the New York Times about uptick in elder poverty, which was on the heels of announcement of social insurance benefit increases for older adults due to inflation and rising costs of living. Right, so similar healthcare, economic security, these big national programs that dole out benefits to individual older people. I want to just take a moment to appreciate the fact that the age-friendly communities movement has really done a service, I think, to the field of aging in showing that it's possible to step outside the box of these focal systems and institutions and think a bit more expansively and differently about what the field of aging can encompass. So I'm going to highlight three ways that I see contributions from this movement in doing that. One is the age-friendly communities movement, as originating with the World Health Organization with a lot of support from leaders in Canada from the very beginning, has helped to increase people's geographic imaginations in aging, I would say. Understanding that aging in place is literally involves places. And so that there's this spatiality and orientation to place that when you're really just focusing on kind of like individual service benefits, you lose sight of that reality, and that environments are actually important and are experienced on a lot of different levels and matter for how people experience later life. Another contribution is that the movement has expanded aging policy beyond aging policy and arguably beyond health policy as well. So, the 8 domains with a focus on housing, transportation, social inclusion, respect, work, civic engagement, right? These are things that have not necessarily been core to what we think of as aging policy and health policy, and certainly the age-friendly communities movement has created space for those sectors within discourse on aging. And then third is the multi-level contribution of the movement. So again, thinking about social insurance, healthcare, long-term care, those are oftentimes thought about as these big federal programs that cut across a lot of time and space. The age-friendly communities movement has really highlighted the importance of both state as well as especially local levels, decision makers, and how in many ways the social context and environments and opportunities for aging are very much dependent on what local decision makers are deciding to do or not to do with resources. And that's also an important contribution. So inspired by the movement, really, my colleagues and I wrote the conceptual piece that was mentioned in the introduction on community gerontology, and this is published in the Gerontologist. And this figure really gets at a lot of the crux of our argument. And we put forth the idea of community gerontology to really make the unit of the community an area of focus in its own right. I think it's fair to say on the tradition of gerontological studies, excuse me, there's been historically a lot of attention to kind of the micro level, like the individual experience of aging, one-on-one relational dyads and their interactions, like how do physicians communicate with older adult patients, or how do family caregivers and an older adult who needs care navigate together. But and then on the flip side, on the other end of the continuum, there's been a lot of attention to the macro level context, like these big programs that we've been mentioning in this context of this talk. But there's this whole middle in between, and that's kind of the first contribution that we intended of this thought paper, is the meso level context, and that it's it's a heuristic. It's not like a defined thing that can be operationalized precisely in exactly the same way from one context to the next, but just this idea that there is this space in between that sits between the macro and the micro that's really important to think about deliberately in its own right. The other major contribution that we aimed with this paper is the arrows, these pathways, and we integrated different traditions and threads of literature within gerontological studies into this framework to pull it into a community gerontology framework as a synthesis, as a scholarship of integration. And there's two arrows in particular that I want to call out, these pathways D and B, because these are the ones that I think are kind of like the arrows less explored in gerontological research. Pathway A, how communities affect people's functioning, health, and well-being, is become a really large literature on neighborhood effects, and basically showing that aspects of our local neighborhoods matter. But these reverse pathways, like how do people's micro-social interactions actually influence their communities and make change at that community level? And then how does the work that's happening at the community level have the potential to inspire changes in these big macro programs, policies, ideas, paradigms, et cetera, is also a little less explored. So we call attention to those areas as really promising and important areas for further development. And then the other contribution that we aim to make in this paper is this idea that gerontological researchers should be called to action, to actually collaborate with others in trying to actualize ideas from studies into systems environmental change, be it within their geographic communities or bigger or different from that. But the idea that gerontology is not just like this passive study of aging, that actually that it's important to kind of get in there and get our hands dirty with trying to make change and translating the knowledge that we're co-constructing for the benefit in the here and now. Okay, so when we think about how have communities traditionally been discussed within research and other discourse in aging, here's what I think, kind of where we are at, what's kind of typical. First of all, of course, operating from a biomedical perspective and the predominance of health in aging studies, we oftentimes think about communities as an alternative to institutional or nursing home-based care. Basically, it's just like a non-nursing home. That's communities somewhere out in the community. There's an alternative, and a lot of attention to like rebalancing public spending on long-term services and supports to be delivered in places that are not institutions, i.e. community-based home and community-based services. We also hear about communities being discussed as like a perhaps overlooked setting where important social services are being delivered. So there's this, idea that like discharge planners should be aware of community-based organizations that they can refer patients to upon discharge to be able to access services to support basic needs such as nutrition, financial benefits, housing benefits. And so that's another place where we hear communities being discussed. We see also that there's this growing emphasis on social determinants of health, and this idea that, the places where we live, work, play, pray are important for our health and well-being. And here we kind of see communities as this like external force that acts upon us and our bodies in terms of our chances of experiencing good health. And then finally, we can even think about the way communities are framed in the age-friendly communities movement. This is the World Health Organization's 2018 cycle of continuous improvement that's meant to guide age-friendly community initiatives. And you can kind of get a sense from the social planning model that the community is a target for change in this treatment, and that it's like this thing that needs to be studied and that needs to be like have some kind of diagnosis or plan for making it better. And then this part, if you see under the ACT box, the implement the action plan. So it's this idea that we develop a plan and then we, address it by action on the community, and then we measure to see how we're doing over time. So all of these things, kind of have this underlying assumption that the community is like separate from people, like either it's a force on people or something that needs to be changed, or a place in which people get acted upon in other ways. And I think the spirit of community gerontology is really trying to push beyond those conceptualizations of community in the field of aging and think about community in a different way. And I want to offer two alternative perspectives that are emerging from contemporary literature. And both of them are outside of our North American context. One comes from Japan and is being promulgated by the World Health Organization, and that is community-based social innovations for aging. And the other is similarly community-centered approaches to public health, not specific to aging, but just this language of community-centered approaches to health coming out of the UK. Okay, so first, community-based social innovations for aging. This is a big umbrella term that can refer to a variety of programs. Like it can refer to something like a self-organized older adult book club, to like a formal program offered by a nonprofit organization that does healthy aging wellness programs. So it's a really varied term. But the general idea is that these approaches involve enhancing older adults' ability to take care of themselves and their peers in the context of social networks and in the experiences of having a sense of connection or belonging to a community. There's a strong emphasis, at least how it's written about in World Health Organization discourse, on the importance of these approaches for helping older adults to stay healthy. So this kind of prevention mechanism and delaying disability that would have older adults require care, especially from publicly funded systems. So forestalling the need for long-term services and supports. The community-centered approach to public health is similar, but I think maybe perhaps even a little bit more elaborated. The focal goal of community-centered approaches to public health is basically enhancing a community's capacity to change social determinants of health. So thinking about the community as a target for change, but also as an actor of change. So it's like this reflexive process where you want the community as a whole to change. And the way you do that is you have the community itself be a major driver of its own change. A focus is on tapping community members' networks with each other and their information channels, how they share resources and information with each other. There's an explicit focus on encouraging multisectoral collaboration, so across different industries, between public and private entities within the community context. And then finally, facilitating civic engagement or the participation of people living within the community as a means for health. So when we think about examples of community-centered approaches, I want to call attention to 4 that are kind of emerging, and I think these will be familiar to many of you. One, of course, is naturally occurring retirement community supportive service programs, and I'm really pleased to see actually seems to be a lot of enthusiasm for NORC SSPs in Canada specifically. In the US, of course, they were championed by New York City, then New York State. There was a national demonstration program, and that's when I was doing research largely in this area. And then the federal funding mechanism for them just went away. And it's been a challenge for many of the nonprofit organizations that champion this model to sustain them over time. But they're still alive and well in New York City and New York State. And I'm glad to see that they're on the upswing in Canada. And they are in other places in the US too. They're just not as prevalent as they once were. But yes, these are clearly place-based models that kind of combine the traditional functions of senior activity centers with wraparound service delivery and really trying to engage neighbors as a source of support and connection for each other in supporting aging in place. The other example is the village organizations, which I'm not sure if the village model has picked up in your context, but in the US, there's more kind of like grassroots associations of older residents who form together to create basically like a mutual aid type organization where members give and receive services, oftentimes with things like transportation, friendly visiting, social programming. So there's a strong feeling of like fostering a sense of connection, and then also people being both givers of assistance as well as recipients of assistance in the context of a real intentional community. We also have the dementia-friendly community movement and the age-friendly community movement, and I'm going to be talking about the age-friendly community movement in my subsequent slides, but I'm also happy in our discussion time to talk about dementia-friendly initiatives as well. Okay, so those are 4 examples, I think, of emerging or established community-centered approaches in aging. Now I want to move on to talk about very quickly some of their key challenges. And there's a lot to talk about here, but just in brief, these community-centered approaches are innovations in many ways. They're really operating outside of traditional health and social services for older adults. And therefore, as innovations, they're relatively rare still right now. I mean, there's a lot of enthusiasm for them, but the odds of any community having these innovations in their geography are relatively low. So there's still the exception and not the rule. There's continues to be a lack of evidence on their effectiveness. And I would say at this point in time, what also is a challenge is there might not even be clear agreement on what the outcomes should be from these approaches. Like if some people say, show that having a NORC SSP reduces falls, which is very different from like show that NORC SSPs enhance people's feeling of purpose in later life, right? So the outcomes are variable, and depending on what values you're leading with, you might emphasize one or the other. And so it's very tricky to measure effectiveness when there's still kind of an ambiguity around what the point of these things are to begin with. Relatedly is challenges around sustainability. Again, a lot of the enthusiasm, like so many other things in aging, comes from like, oh, this is a great idea, and can get started, but then have a hard time staying and operating over the long term as conditions change. Another challenge is the overall lack of centering of issues of equity and intersectional social positions with age. In the context of ageism, it's very hard to get people to think about aging to begin with, but then you start layering on other systems of oppression and diversity, such as race, economics, gender, LGBTQ plus status, and identities, other identities, ableism. So yeah, it's hard. And, there's a lot to unpack in these movements as they are, but, they operate in the context of all these systems. And I think it's fair to say that it's a challenge to kind of talk about all the things at once, and that as on the whole, they really haven't centered these issues, although there's more kind of added discussion on them on top of the usual discourse. And then finally, related to effectiveness, there's just minimal evaluation. And we can say that a lot of these challenges stem from the fact that there really aren't great public policy supports for these community-centered approaches. Like we talked about, they operate outside of traditional health and aging policy. They're really not focused on the people that I perceive policymakers as highly attuned with, which is people who really need the long-term services and supports because of financial and clinical need. And as community-centered approaches, they are ultimately implemented at the local level. And I think it's fair to say, in countries where government control is kind of decentralized. It's hard to pass a big federal policy or even a state policy on something that's really meant to be targeted at the hyper local level. There's just a lot of issues with control and monitoring that makes it more challenging. Okay, so all that being said, how can we go from a promising idea or concept in these community-centered approaches to actually a program that would be fundable by public policy? I believe is really key to issues of all the things we talked about, but especially when it comes to considerations of equity at the individual and community levels. So what might that be? And I would like to offer here as part of this talk that collaborative research on program theory is a really important part of figuring this out. It's not the only piece, but it's certainly an important piece of taking what seems to be a promising idea and moving it toward a fundable program model. Of course, other things like good data, results, political will, public will, those are all important. But for the purpose of this talk, I'm going to just focus on the collaborative research on program theory. Okay, so briefly, what is program theory? So any good evaluator, will know this, that it's an explanation of why an intervention program or strategy will achieve its intended outcomes. So, when we look at something like a dots on the map of all the age-friendly communities that are associated with national or international networks, it's really thinking about like, what does the dot on that map mean and what activities are they doing? What resources are they using to lead to what outcomes? And we can imagine that there's a lot of variability, even though all the dots look the same, right? And so that's what program theory is really trying to articulate. There's a lot of challenges with developing program theory for community-centered approaches, I would argue. First of all, they're inherently complex interventions because, of course, communities are these dynamic systems with a lot of moving parts addressing a lot of different issues. And so they're going to have multiple components. That's kind of the idea. It's not like, I'm experiencing pain and a physician prescribes me to take this amount of over-the-counter, pain medicine at this dose for every hour. That's a very simple intervention with a very targeted outcome. That's not the land in which community-centered approaches live in. They have multiple components, which can make them trickier to evaluate. They're also operating at multi-organizational intersectoral systems level. So again, that meso level is nested within the micro and the macro. So there's all these layers of context that influence how the community-centered approach is happening, how different people are experiencing it, which also adds in layers of complexity. And again, as we discussed, the outcomes are multiple and perhaps contested. That being said, I want to share kind of what our team's approach has evolved as over time to still go for it, to still, in spite of all these challenges, to use our resources to try to collaboratively develop program theory on these approaches. So you see here, first of all, our research largely centers the voices of practice leaders. So we listen very, very carefully to the people who are community leaders and who are working day in, day out to implement and develop these approaches. And we use largely qualitative research methods, although we're starting to use more quantitative methods as well, and all their rigor to find patterns and to use the data to make certain interpretations that come out as theory. We do projects of mutual benefit, meaning mutual benefit between us as researchers and the practice leaders and the practice leaders with whom we're working with. So the question has to be something that is of equal interest to both parties, not necessarily for the same reasons, but definitely like if we knew the answer to this question, both sides would be benefited. And then finally, we pursue grants for this work. I would say it's hard to keep this work sustainable without the infusion of external resources. The university is a huge support, but it's not enough to really have the capacity that we need to do this work well. And so we put those things together and we develop program theory on community-centered approaches. So I'm going to talk really briefly about the work, one aspect of my work, and it's a big part. It's in the context of age-friendly North Jersey. So that's the region in which I live, work, and play. And this is a network of age-friendly community leaders that has been spurred by two private philanthropies who started a grant making program in 2016 because they wanted to see dots on the map in their region. They care about aging, they understand the promise and the importance of investing in communities. And so they developed cohorts of grantees, and we've been working in close partnership to serve as the developmental evaluators on their work, and over time, deepening our partnership among other components. And so I want to show you, this is our one-page infographic that needs some updating, but it's still pretty relevant. I want to point your attention to a few things. So first of all, this network is really focused on age-friendly leaders who are doing the work at the local level, who are implementing age-friendly community initiatives in their municipalities. That's different from other networks that have governments sign on or municipalities as a whole sign on. We're working with individual, like frontlines people who are leading these initiatives, regardless of what sector they're from. Also of note is that we facilitate this alliance in partnership with the two philanthropies. So it's the Rutgers School of Social Work in partnership with the Henry and Marilyn Topp Foundation and the Grata Fund for Senior Care. They're two place-based philanthropies who have a portfolio of work on aging. And we are in communication regularly to make decisions and kind of guide the strategic direction and supports for and with the community leaders. And of importance, we have one of the community leaders who's also a journalist and a communications consultant who is a partner on this coordinating committee, who also informs our group decision making. And here's our strategy. So you'll see that we do a lot more than just research, although I'm going to focus on research for the remainder of the time in large part. But it's a lot of capacity development, like really cultivating this community of practice. Even now, we could add another bullet point. And yeah, I should say the coordinated advocacy is becoming more and more of a focus as we realize how the challenges that people are facing in doing this work at the local level are embedded within larger state policies, state and county policies. So that's become a growing emphasis. And we didn't just start as an alliance, right? This was really something that didn't happen until 2021, even though the initial conference for the grant making initiative started 6 years prior. So it's been really an incremental build toward having this structure and having the Rutgers School of Social Work be part of that. We really started as a small kind of applied evaluation project, and over time recognized the growing need for us to translate back what we were learning with people in a more systematic way, and to kind of solidify this network through the alliance. And you'll see in 2022 we've been growing, and the philanthropies continue to do the work. And now from the Rutgers School of Social Work perspective, we have the newly created Hub for Aging Collaboration, which is related to this program research and other projects, where we're really trying to elevate excellence in collaborative research, training, and engagement to improve social context for healthy and equitable aging. Okay, so I'm going to talk now in the little bit of time we have left on the academic side, like how we've published and advanced gerontological knowledge through the co-constructed understanding of age-friendly community initiatives in this context. So this just shows the variety of articles that we've published over the years. So we have, the one on the top right is trying to understand how older adults are involved in these initiatives. The one on the bottom left is looking at community events in particular as like an age-friendly tactic that's very common in these initiatives. But I'm going to take a little bit of time to talk about this recent one, which was the role of the initiatives during the COVID-19 pandemic. And I think this one really highlights the application of everything I've been talking about in terms of advancing meaningful program theory for community-centered approaches. So briefly, for this study, we conducted in-depth Zoom interviews with 8 age-friendly community core teams approximately 9 months into the pandemic. These are 8 initiatives that span northern New Jersey, have been receiving philanthropic funding since 2016. They're our original cohort of communities that were involved in this alliance, and or the grant making program at the time. The alliance didn't really exist then. And it was our 5th round of interviews that we ever conducted with them. So we've been doing these interviews for quite some time, and we were fortunate to be able to have that relationship to meet them in this very important historical moment of being 9 months into the pandemic. Our team did extensive background to customize the interview questions for each interview. So the interviews lasted about 90 minutes. And I think part of the reason why we were able to be so efficient and get such richness from the 90-minute sessions was that we had a lot of background information. We had information from the prior interviews of how their initiatives had been developing since 2016. And then also participating in leading alliance meetings, we'd been hearing from them what they'd been working on all throughout the pandemic. And so we had all that background coming into the interviews. The focus was not just to understand the what of their activities during the pandemic, but more importantly, the how, like how were they doing the things that they were doing. So briefly, we found 4 main roles that the core teams played during the initiatives. And I'm going to briefly go through each of these, but I can share my slide deck or happy to go back. They have more information than I'm going to have time to cover, but these are 4 qualitatively distinct roles that we found that age-friendly community initiative core teams play during the pandemic. So the first, I think, is what's most intuitive, like what was been talked about of what these initiatives do, as the role of the creator. And so these are things of actually like the core team leaders themselves notice gaps in services and supports during the pandemic and fill that need themselves, either independently or with their community partners, but they're really initiating the creation of some new community event, program, or service. So an example of that is like creating a friendly callers program to check in on people during quarantine to see if they need basic needs to be met. The other one, kind of relatedly, is the good community partner. And this is when the age-friendly core teams would help out another organization that was trying to meet some need out in the community during the pandemic. So it's time-limited financial, instrumental, or informational support for a community event, program, or service that another community organization is leading. So for example, a local senior center wants to do a Zoom-based exercise program, and the age-friendly community initiative is able to pitch in to help cover the instructor fee and make that happen. Even though it's not an age-friendly owned program, it's the senior center's program, it's made possible in part because of that financial contribution of the age-friendly community initiative. The third role is of a communications broker, and this isn't just like sharing and blasting information out to the community during pandemic. It's really this idea of creating bi-directional and systematic exchanges of information across networks of community residents, partners, and state or regional entities. So many of the initiatives actually conducted surveys of older adults during the pandemic to see how they were doing in a systematic way. So it's kind of systematically collecting that information from older residents and then sharing it with municipal leaders to give them good information on how to reallocate and adjust their own pandemic responses. So it's really that dynamic use of information across networks. And then finally, advocates is the age-friendly leaders encouraging their community partners to be more inclusive and intentional in considering the needs of older adults in their COVID-19 responses. So for example, helping a new grassroots organization identify a location for a food distribution hub that would be more central and accessible to older residents with food security needs. So really encouraging them to be strategic in the placement of that new food distribution site in a place where the older residents who need it are more, have an easier time accessing it. Okay, for the sake of time, I'm going to skip this, but I just want to say that in general, in the paper, we interpret our findings according to a network nonprofit perspective. We found that similar to traditional service providers, the age-friendly leaders were working tirelessly on issues like food access, social isolation, digital connectivity, and access to information, but different from traditional service organizations. They worked on these issues largely by fostering and leveraging strengths and relationships across local groups, organizations, agencies, and individuals. And this social capital that's so important emerged in part from the strategic age-friendly network development that the initiatives were intentionally cultivating long before the pandemic. So the network nonprofit perspective encourages recognizing organizations that are not necessarily the brightest stars in the galaxy, that is, the ones with the biggest budgets, the most staff, or the greatest programmatic offerings, but instead the perspective emphasizes the importance of rewarding constellations of stars with meaningful and intentional connections that together contribute to an even bigger, more coherent, and more dazzling whole. And this work, in conjunction with other pieces of our program of research, are really working toward a theory of change for local age and dementia-friendly initiatives, thinking about them as community capacity building interventions in aging. This is a term that comes out of work on youth development and economic development outside of the field of aging in the late 90s and early 2000s. But it's really relevant, I think, to the space that we're working on in the study of aging. It's the interaction of human capital, organizational resources, and social capital existing within a given community that can be leveraged to solve collective problems and improve or maintain the well-being of the given community, and it operates through informal social processes as well as organized efforts. So here are some of the other projects, research projects that are in the works, but I think for the sake of time, I'm happy to leave this up if people want to discuss any of this, but I'm really at this point eager to hear your voices and have some discussion. So thank you.
Emily, thank you so much for the conversations that you've brought forward today and for your ongoing work. I know personally I've really learned so much from your community gerontology framework in my work with public libraries. At this time, I might open the floor up to those folks perhaps who are joining us in person, if anyone has a question that they would like to raise. Thanks, Audrey, go ahead.
Thank you, Emily, for a really wonderful seminar. I'm Audrey, I'm from the McMaster Institute for Research on Aging. And I was thinking about this figure you showed, and you were talking about how you can sort of flow back up into higher level governance structures if there are mechanisms for that, right? And so how do these like really great grassroots things end up getting taken up? And that's all that can be challenging. And I wanted to know if you had any comments about some really any of the effective mechanisms you observe to help facilitate that, particularly you know, in the academic and research world.
Yeah, it's a great question, and I could spend a lot of time sharing some thoughts on that. I mean, I think the number one thing is, I feel like at this historical moment in our context, it's really hard to do this in a silo. Like, I don't know how it is in your world views, but like the government leaders aren't necessarily like reaching out to academics as a resource to see what they could be doing differently. Like, it's not the way, that model doesn't really work anymore. And so to get the attention of decision makers, I think it's essential to work with those outside of academia and really build networks and coalitions that can speak in similar voices to get the attention. I think it's especially tricky in community work in aging that, you know, policymakers, I think in large part, are kind of clued in onto considerations of healthcare and pensions, because if you think about who's meeting with them, kind of, and what policies already exist where they're already spending money, it's just hard, you know, to get them to orient to like yet another thing in aging. And I think that's why change is slow, but that's also why it's so important to use the time that we have to keep going at it. I mean, I think it's important to just be humble and patient. It's hard, it's really hard, but sometimes I think, like, especially with age-friendly community work, rushing to a passage of a policy that's not well understood or articulated can actually in the long term create more problems, because at least when nothing exists, we can all agree that nothing exists. and that there's a gap and it needs to be addressed. But if policy is created such that it exists on paper, but there's no capacity to actually implement it, or no one really understands exactly how it's different and what it's supposed to do, it's not going to actually create the social impact that we would hope for. So in my, in the United States, like a focal policy I think about a lot is the Older Americans Act. That's like the fundamental piece of federal legislation that's supposed to support aging in community and aging in place. And, it's been updated through the years, but it's in many ways remained the same since it was originally passed about 50 years ago. And I think there's so much, like the intention of that piece of policy is so aligned with community-centered approaches, but to actually create space in that act in a way that's sustainable. I'll just say, like, I think in 2015, there was this community innovations for aging in place. And then in the next passage that got cut. And I was like, oh, like that would have been a great foothold in, but because that was passed without, I think, the knowledge we have today now on what these interventions are actually supposed to be doing at their best, it was so easy to cut it because it seemed like, oh, these are just pilot programs that aren't really sustainable and can't really be scaled up. And so it was just an easy place to just cut. So there it was in 2015, and now it's not there. But it doesn't mean that I don't think about these things in the long game. And I really just feel like this is the work of generations. Like in my own lifetime, I hope it helps for people who will live beyond me, and it will take an arc of work to get done, but we use the time we can to do what we can while we can. It's kind of how I think about it.
This is awkward. I'm going to hold the computer in front of a computer and then ask you the question that's that Barry's offered from the chat. Thank you, Barry. He asked if whether you could perhaps discuss differences that you might expect when dealing with Canadian age-friendly groups, which you may or may not be as familiar with, compared to American, and particularly with some of the differences we have with our healthcare system, our socialized comprehensive healthcare system versus American setting. So if you could speak to that.
Yeah, I really appreciate that question. Actually, one of the projects that I'm working on right now is with Elizabeth Russell out of Trent University. We're in the process of doing a scoping review of peer-reviewed research on public sector involvement in age-friendly community initiatives, focusing on the United States and Canada. So through that project, I've learned a little bit more of how the movement has developed. And there are some really interesting similarities, but some also really important differences. And from my perspective, one of the key differences that jump out is that you've had national leadership for age-friendly communities in Canada through the Public Health Agency in large part. In the United States, we don't have that. We have AARP, which is a private organization that's really been the champion of the movement. And I think it just creates kind of a different premise for municipalities that are joining. Maybe even more importantly than that is the fact that your provinces have really, it seems like, embraced age-friendly community work, even if there's I understand a range of how much funding and support is offered from one province to the next. I don't know of any state that has dedicated funding to local communities to implement age-friendly community work in the US. There's California has embraced age-friendly communities as part of its state master plan, but I don't think has dedicated funding for the implementation of these initiatives. And similarly, Massachusetts has an age and dementia-friendly framework at the state level, but not any grants or financial support. And it's not to say that those frameworks, like having a state organized movement, is not valuable. It's actually our research in Massachusetts. We've done work on dementia-friendly community initiatives in Massachusetts. It's showing that that state discourse is really helpful for local leaders to be inspired, to be motivated, to feel that the work is meaningful, to be able to connect to other groups that are doing this, to say like, oh, the governor is talking about this. This is something we should be paying attention to. That stuff counts. But again, in terms of issues of equity and reach and sustainability, I think part of what we're trying to do with our research is just show that like the actual leading of these things is work that takes skill and time and resources, and that could be invested in just like other other approaches as well. So yeah, I mean, my sense in Canada is that in many cases, the grants to local communities have been pretty modest in size. And I think it's enough. I mean, I don't know, I'd be interested in talking with you all about this, but a lot can be done with a little infusion of funding, but in some ways, the little bit makes it seem like maybe a misperception that more is being invested than it actually is, and puts real limits on what communities are able to do, especially in the long term. But yeah, I think this kind of North American comparison of the movements between Canada and the United States is really ripe for like more intentional cross-national comparison. My sense is that like our colleagues in Europe and the World Health Organization have kind of been the central hub. But I'm kind of seeing some signs that there's greater interest in our hemisphere of, or just like our continent, you know, of Canada, United States, and the countries to the global south in the Americas are interested in having more discourse and learning from each other, because I do think there are really important geopolitical, social political differences between at least the US and many governments in Europe that would make this geographic comparison perhaps very valuable. Like we're missing something by not looking more intentionally at these issues across our countries.
The floating head popping in again. Thanks, Emily. We just had one last time here, perhaps one last question in the chat. Janet had asked if you'd be able to pull up your last slide and perhaps just chat a little bit about it or some further context.
Sure. Is it the one on future projects or works in progress? Is that the one?
That's a great question, Janet. I'm
Yes,
wondering.
yes,
Oh,
it is.
okay, perfect.
Thanks, Janet. Okay. Yeah. Yes. Okay. So yes. So this is research projects. There's a lot of like engagement projects and other projects that are happening simultaneously. So these are just the research ones. But I can talk through them. I'm happy to. So the first one is using sociograms as a tool for visualizing age-friendly community initiatives as network interventions. We're actually presenting that work at the meeting of the Gerontological Society of America next week. And we've conducted with our Alliance network a social network survey of the core teams and their referred partners. So we've administered quantitative surveys, and we're starting to use sociograms, which is part of social network methodology, to look at the connections across the different actors. And it's pretty exciting. I think when you actually see the sociograms, you could really get a sense of how these things are operating at a community level or network level by looking at the relationships and positioning of different organizations and groups as part of an AFC intervention. So that's the first one. The second one is a more thought piece. It's going to be a book chapter doing a critical analysis specifically on the centrality of social planning models within the AFC movement. So that cycle of continuous improvement, which has been promulgated by various organizations, is like the guidance for what network members are supposed to be working on. The idea, like you get together a team, you do a participatory comprehensive community assessment, you develop a plan, you implement the plan, you monitor it. The idea in this piece is that that model is one of many models that could be used to guide this work, and our continued focus on that specific model is kind of boxing us in. That doesn't really work for the diversity of players and possible leaders in the movement, and thinking about how that model could be, its centrality could be an issue with issues of diversity, equity, and inclusion, as well as sustainability, effectiveness, and reach. So that's an essay in development. The other one is the scoping review of the literature on public sector involvement in AFC programs in Canada and the US. I talked about that one in the last comment. And then this final is kind of a big bucket on using health services data, basically healthcare claims through Medicare, like looking at people's administrative records of their use of healthcare services, as well as what conditions they have over time. to try to demonstrate the population health impact of local infrastructure for aging. So the one on senior centers is actually part of the project that we're doing in Massachusetts with support from the Alzheimer's Association. We have wonderful colleagues at the University of Massachusetts, Boston, who have a comprehensive survey of senior centers at the local level. So in Massachusetts, they have, by state policy, they have to have a senior center in each of their municipalities, which is really unique. I don't know of any other state in the US that has that. And so then we have the survey data that shows the range of funding, their staffing, their programming, like really getting at their capacity as organizations. So we're going to start looking at linking that data with healthcare claims data to see if people who are living in the community with dementia had better healthcare utilization both before and during the pandemic. But we have similar projects in the works with thinking about AFC initiatives, as well as with village organizations. So that's kind of a new direction for our group, but we feel it's really exciting and important to give this hypothesis that like local infrastructure matters for aging in place and aging in community by using the best data available that we have. And I'm doing that work in collaboration with a health economist who's also on faculty at social work. And so we're drawing on our respective strengths to try to lead that program of research.
Great. Thanks so much, Emily. We are at time, and I guess because we have a physical space, we actually need to wrap up here. Before we thank Dr. Green, our next Gilbrea series will be taking place November 24th from 2:30 to 3:30. We'll have Dr. May Chazen joining us from Trent University, speaking to Restoring Apocalypse, Intergenerational Storytelling on Aging Futures. And this recording will be made available on YouTube. I know there's one question about some references, so that person can maybe check out Emily's fantastic presentation once that's available on YouTube. And again, Dr. Greenfield, thank you so much for joining us and for sharing with us today.
Thanks for the opportunity and to everybody for making the time to be here together. Appreciate it.